So once again, my name is Ruth Schwendinger. Joining us today for our Capacity Builders Workshop is Ieshia Dawson. Ieshia is going to introduce herself and go ahead and take it away.
You're on mute.
Sorry about that. Hello, everyone. As Ruth said, I'm Ieshia. I work for Prevention Network, and I'm over the prescription drug overdose grant. And today I'm co-hosting with Ruth, and we're going to go over the capacity builder workshop with everyone.
Yeah, so thank you, Ieshia. Our focus today, as we're talking about how to build capacity, is on reducing stigma and harm reduction. There's a couple of buzzwords in there, and so I don't want people to get hung up on that. We are going to do some definitions to make sure we're all on the same page. But to start with, I want to go over just kind of our expectations for the next hour and a half. We have a shared purpose, and I believe that our shared purpose is to understand how better to serve our communities, because we want our community members to be healthier, to be happier, to have a more positive outlook on life. And part of what we do at Prevention Network is we promote this culture of growth. And that starts with a humility of understanding I have a lot to learn. And so Ieshia and I talked a little before the meeting tonight. I hope that you will feel free to jump in, either in the chat or just go ahead and unmute yourselves and jump into the conversation when you have something you would like to share with us, or a question, or just some personal experience that's relevant. And through honesty and recognizing that we all have room to grow in our understanding, we're going to continue this culture of growth and understand that we might not have all the answers people are looking for. But I encourage you to still ask the questions, because if we shy away from the questions we don't know the answers to, we're not going to grow. The fourth thing here is our challenge by choice. Oftentimes we ask questions, and I'm going to ask for you to participate throughout. But at any point, I want you to feel comfortable saying no. It's okay to step back and not participate. Part of that is we are recording the session so that people can view this at a later time and learn from our conversation this evening. But at any point, it's okay to just say, I'm not comfortable with participating at that level. I'm going to sit back and listen and absorb. And that's okay too, because we all have different learning styles. So we are recording. If you joined recently and didn't get a chance to introduce yourself, please introduce yourself in the chat. And a final note here, your safety is a priority. If anybody appears to be driving or operating a motor vehicle, I'm going to ask you to disconnect from the meeting, and we will start again. You can view this recording on YouTube at a later time. Any questions about that? Okay, then Ieshia is going to take it from here, and I will advance the slides as she directs.
Well, hello. I wanted to jump in because we are in the season of we are in the holiday season, and at the end of the year, there's a lot of stress, and and so I wanted to prepare everybody and just get everybody together to learn a little bit about addiction and surviving stress over the holidays. And so it can be a lot when families of active substance users are in recovery, so they need that extra support around the holidays. And so I gave like 4 strategies for the individual, and then I also gave 4 strategies of what families and the individual can do to help reduce some of this stress. For the individual, they will have to prepare ahead of time. Sometimes it could be a little overwhelming, so they need to, have a recovery kit where if they feel overwhelmed with the celebrations and people are doing a lot of things around them that they are not comfortable with, they can, you know, be able to have some type of backup plan or some type of sponsor that can help them along the way to make them more comfortable. Arrive early or leave early. This gives them the option to, you know, consider if alcohol is being served at the party or drugs are being used, they can have some type of, you know, escape plan to leave, or to leave early. And then also when they do, you know, departure, they want to have some type of excuse so they won't feel uncomfortable of family giving them that stress of saying, why you're leaving so early. And then also bringing beverages. If somebody's an alcoholic and they're recovering, sometimes it's okay for, you know, family members to have alcohol out, but you also, they should bring their own beverage so they can feel comfortable with participating like a toast or anything, and they won't feel, you know, a lot of stress with that. And then also have an escape plan. If anything arises in the gathering, or they just feel like it's just too much to take in all at once, you know, maybe an argument take place with them because they are addicts, and, you know, people, you know, tend to, I won't say nitpick, but we'll go over stigmas in a little while. But you want to make sure that, you know, any situation that arrives, you want to be able to have that escape plan. And so for families, I know we always trying to save save the addict, try to save the person from addiction, but we need to also manage our expectations of that person. You want to be able to not have expectations, if that makes sense. You want to be able to make sure that you want to be able to be in your truth. You want to make sure that you just are sensitive to that person, be a little compassionate, and then understanding the approach of what they may be going through. But you don't have to have expectation that this person is going to act this certain way, because it may not, you know, happen that way. And then handling actively using addicts. And sometimes that can be so personal to people that, you know, that they are overwhelmed and they want to show so much love, but that person may not be in that space at that time. So, you know, just approach them with, you know, allowing them to attend the gathering. You don't have to abandon them from the gathering. You can also, you know, set clear communication and boundaries, because they know that, you know, they are using, but you just want to make sure they feel comfortable. And if they don't, or if they allow you to feel uncomfortable, you just have to communicate those boundaries and have that setting over the, you know, holiday season. Also, supporting the recovery addict. That's very important because, you know, they are in a stage where everything is vulnerable. So you just want to show concerns, but don't take it too seriously. You don't have to celebrate it or anything like that, but just recognize it and then move on, because that's what we all want to do. We all make mistakes. So you just want to be able to recognize that they're doing something positive to help to recover from the addiction, and then just move on and let them know that you're here to support. And then learning to let go. Sometimes that's within the physical trait or emotional stage that we can't let go. We try to hold these people because we know we care about them so much. And so we just want to be able to be the support system they need. So you just want to, you know, just treat them as so, you know, and make sure that you just help them along their journey to recovery. Any questions for me?
I have a question.
Okay. Hello.
You mentioned a recovery kit. I'm familiar with like coping kits. Is that the same thing? Like, what types of things would anybody on the call, what types of things would you put in a recovery kit, like a small backpack or a bag or something that you carry with you to the holiday parties? Maybe you can put that in the chat and I will move on to the next slide if nobody else is wondering those questions too.
But yeah, one important thing though, Ruth, is always have a contact number. because sometimes you may not be able to remember numbers nowadays. So just have somebody that you can lean on when things get tough. And then also maybe a book or something self-help to help you, cope as well.
Okay. Thank you.
And like I was saying, like during the holidays, there is a lot of things that people associate with addiction. And so stigma is one of them. This is something that is prejudged, wrapped in shame, born of ignorance, and fed by our fears. And so we just want to just be able to, discriminate against this, no matter who, where, or where we at in that place. We just want to make sure that we don't stigmatize people. And sometimes stigma looks like somebody that's unworthy, somebody that don't need services, somebody that's always being judged. So we just want to stay away from those stigmas. And how can we stigmatize people? As we see, there is bias, stereotyping, labeling, avoiding, and shaming those people. So we just want to use first language. Always put the person first. Their behavior may change over a period of time. So you just don't want to label them and you don't know what they're going through. Because every addict or every person that has a substance abuse or alcohol problem may not just come from, street drugs or anything. It could be prescription or anything else. So they could be sick or anything like that. So we just want to keep from being stigmatized or using those type of words. And so we get into harm reduction, and this ensures that drug users and others or people who have used has a voice. They can use their real voice to create, change and different policies to see how we can serve them better. And so with harm reduction, it is the practice of recognizing when licit or illicit drugs are used and happening and implement effective strategies to use less harmful. So we just want to make sure we are firm with them, and then also find ways to reduce it by recognizing that people deserve to have safety when using drugs and also dignity as well. Meeting people wherever they at, that means just, you can't change the process. Some people is not ready to change at the time, but if you can help and support them along the way, why not? And it's a lot of people who don't believe in harm reduction, but it has been evidence-based that it does work. And also providing support and using safer use and managing use, and also abstinence when it comes to harm reduction as well. And addressing unsafe outlining conditions of all use. So we all in all, we just want to make strategies to meet people in their actual needs.
We're going to unpack those a little bit more, but are there questions at this point? Invite you at any point to put questions in the chat box.
And so with harm reduction, this is a great one because people think that harm reduction is something that is promoted, but it's like it recognizes the reality that both people are vulnerable in this capacity of dealing with drugs and how it's harming people. So you treat drugs use as a mortal failing of the individual or blaming family members, deny that drugs are harmful or promote drug use. So these are things that harm reduction does not do.
There's a comment in the chat that a lot of people think harm reduction is promoting use. And that's exactly why we put this slide in here, is because a lot of people misunderstand what harm reduction is. Mm-hmm. And so we're not denying that drugs are harmful. We're not promoting drug use. We're trying to do what it said on the previous slide, address those unsafe outlying conditions to make their lives safer, because they are whole people.
Yes.
Substance use being one part of that.
And so I wanted to go in a little farther with how harm reduction looks different on the individual or the family scale. And sometimes the individual use licit or illicit drugs can also affect how people, like you said, how people look at them as well. And so recognizing this, we want to make sure that they do not share or borrow needles, borrow drugs, using supplies like injections, or, straws or anything in that nature. Consider, regular testing for STIs, HIV, and hepatitis C. Learn how to take home naloxone, show others how to, or you can train others on how to, take properly care of naloxone at the home, and keep a kit with you at all times if you know somebody who has an addiction, or you just want to know what it is, and you can do any trainings for that as well. Call someone before using as well, so somebody will know if you may have overdose and they don't hear from you for a while. At least you'll have that contact on hand, and access mental health services and non-professional support to help you learn the journey. And these are for individuals. And it's hard when you love someone and they using these, it has an addiction. So you want to be able to learn how to properly care for them in this state as well, and for themselves. And I did have one thing that I wanted to state as well, like naloxone or Narcan. Sometimes this drug is temporarily reversed. It's respiratory depression from opioid overdose. So you can use this. Have anybody heard of it or have any at home, or had to use, Narcan for any reason? Okay, so Ruth has it in her bag.
I have Naloxone at home, but I haven't been trained on how to use it. So that's something that I need to get trained on. But yeah, I just have it at my house because why not? If I can help somebody, even if it's a neighbor or whatever. I don't think it ever hurts to have it.
It doesn't. Yeah, and so Michelle said addiction is problematic ways of coping. Yes.
Yeah, and that's why having a recovery kit or a coping kit with you helps, because we know that oftentimes holidays are stressful, and those gatherings where you're back with family and friends who knew you before you were in recovery makes it a lot harder to maintain that recovery or maintain your path in recovery, even if you're not looking at complete abstinence right now. It absolutely is a way of coping for some people. Are you ready for the next one?
Yes. And so I gave some type of tips for family members who take care of people, or who know someone that may be close to them dealing with addiction. Make time for self-care, because self-care is one of the biggest things we forget to do when we're caring for others, or just experiencing joy and happiness. Make sure that you are willing to take care of yourself first, because like you said, addiction is a problematic, and you never know when somebody will go to recovery. It's like a circle, constant change. So take care of yourself is one good thing. Take some time to realize what you do and do not have control of. Some of these helpful strategies may be staying concerned with expressing care, love, and also how to spend time with them. So, when they are in that stage, you can still love on them. You can still have that bond with them. Just making sure you're controlling yourself as well. Get involved in support groups. There are so many support groups. I know people belong to churches, organizations around areas. I do have a list of some in a couple of slides that you may see as well. Especially those that the youth in the community, they reinforce family training. So you know, there's a lot of recovery coaches, you know, come to help and talk about, you know, educating people on naloxone and all different kind of things as well. Be prepared and be okay if the loved one says no or changes their mind. Offer help many times in many different ways and with many different options. When I was looking at different research, there's so many options family members did. And sometimes you just have to say, no, I don't have any more, but you can always find resources and someone to help you. And if you run out of those choices of help as well. You can go to the next slide too. And so special consideration for children and youth. I think this is very important because I had since I'm in this, in my grant, I went to a community workshop training and somebody gave a child, you know, some naloxone kit and they helped save their parents' life. So kids can be affected by this as well. And so they also can get trained in harm reduction as well as also training on how to use naloxone properly too. So children and youth affected by families of opioid use disorder are more likely to experience child maltreatments and neglect, witness family overdose, and then also have trauma reactions to that. And benefits from therapeutic interventions will be helpful as well. So like I said, you're never too young to understand addiction. It's just the way we word things for our children. And so our next slide just give you help at the community level and some best known harm reduction tools to include. We got the syringe services, which you get, you know, naloxone kits, free syringes program, overdose prevention sites. It's just a lot of things in the syringe services. If anybody's familiar or have any tips or resources, you can also put it in the chat as well. There's a lot of referral services for moral support, education, and also help with, you know, those who overly use and need medical or wound care. It's a lot of referral services with that. And then accessible resources where people can use in their community or in their county to help along the way with some of these harm reduction tools as well.
Everybody's affected by this. And so you're talking about these accessible resources. Anybody in the community can be a source to connect with because it's affecting everybody. So I think that's a good thing to consider. Thank you.
Thank you, Ruth.
We're going to transition and talk specifically about 6 CSAP strategies for prevention. But before we do that, I do have a quick question, a quick poll for everybody. And so if you all could answer this question really quickly, and then we'll move on. And go ahead and put any questions or comments you have in the chat box. Ieshia and I are going to continue monitoring those. So thank you, everybody. I'm not going to share the results with you at this time. The Center for Substance Abuse Prevention strategies are a lot of different ways in which those of us who work at the community level or who are working specific programs in our communities can affect harm reduction in different ways. And so these are the 6 strategies. So information dissemination, education, alternative activities, problem identification and referral, community-based process, and environmental strategies. And so I want to ask you all to help. What are some ways in which information dissemination can affect harm reduction? And I've put a couple of my ideas here, but I wonder what you all think. What are the ways we can use the strategy of information dissemination to impact harm reduction? And so my thoughts here are, we want people to know what an overdose looks like. Information dissemination is one-way communication in which we're providing information. We want people to know what an overdose looks like, whether it's an opioid or whether it's a methamphetamine, or whether it's we want to recognize if there's a combination of substances at play here. Cannabis and alcohol combinations are really common that we're seeing in emergency rooms right now.
We also have we have social norm campaigns.
Mm-hmm. So social norming campaigns are often something we use with the environmental strategies. And so that could go either way. Absolutely. Though. We want people to know about the disease model of addiction. We want people to understand that the actual structure of a person's brain changes when they have the disease of addiction. And in that model, we understand that we can recover, that we can, through time and effort and training our brain, we can re-achieve a healthy outlook on life so that we're able to actively have a fulfilling life where we're engaging with other people in positive ways and we're contributing back to the community in different ways as well. One of the final ways that I'm aware of that's really common for information dissemination is, where do people get more information? Where can I go for treatment? Where do I go for Narcan? Where do I go for recovery supports? And that's basic information dissemination. Because those resource sharing, it's kind of a one-way communication.
We have one more in the chat as well, say we want to continue the conversation so people are aware and more willing to help, thus reduce feelings of discomfort, answer questions related to misperception.
Mm-hmm. And that's the second CSAP strategy. So you're getting ahead with education. It's a two-way communication. It's a back and forth. It's a building of skills and knowledge and understanding, so that we're having those conversations with people. It can happen one-on-one. It can happen in large groups. But we want people to learn more about the disease of addiction and have those conversations with us so we can understand that it's not a moral failing. It's not the fault of their upbringing. It's not the family's fault. That this is a consequence of a lot of different factors impacting a person's life. And regardless of looking for someone to blame, we want to focus on a solution. We want to focus on helping the whole person. And so through education, some of the really simple things we can do for harm reduction is teaching people the skills of how to administer Narcan. It used to be a little more complicated with the intramuscular injections. Now it's really easy to get a nasal spray. And so that's an easy piece of education that we can do as a CSAP strategy for harm reduction. Another piece is those family classes or groups, because a lot of what we do with prevention is about relationships. The core of substance use disorder prevention is relationships. The core of what we do is connecting people with other people. And we can do that through groups, through family education, through psychoeducational models, so people understand what are the factors, the risk factors in this person's life that we can kind of mitigate to help them have better chances of living the recovery pathway that they're looking for. Another really simple one is teaching people how to position someone in a recovery position. So if someone has overdosed, they're not likely to pass away from not being able to breathe or choking or some obstruction in their throat. So when we're looking at that, a recovery position is an easy harm reduction technique we can use for the educational strategies in CSAP. And Ieshia is going to talk a little bit more about what to do and how we as people who focus on prevention can impact the lives of a person after they've experienced an overdose. But I do want to highlight that as one of the educational strategies we can use. Are there other thoughts on that in the chat? Okay. The third CSAP strategy I was going to talk about is alternative activities. And so somebody earlier said that people use substances as a coping strategy. And what we want to provide is opportunities for people to engage in fun social activities in the absence of alcohol or other substance use. And so some of those things are sober parties, have sober holiday parties, plan them, allow everyone to have that expectation of, hey, we're going to have a great time. There's going to be music and food and dancing, games. We're not going to have substances here. The simple expectation you can set ahead of time. You can do events with the family that are anti-stigma and awareness campaigns. There's a lot of Walk for Recovery and Fan 5Ks and things like that we can engage with our families that focus on reducing the stigma, that focus on raising the awareness in our communities. And that's a great way to engage as a CSAP alternative activity. The last one here is kind of a gray area. So community events, fairs, and festivals. As people who have family and friends in recovery, who have family and friends with a substance use disorder, we want to try to normalize those events that don't include widespread alcohol and drug use. So a lot of the places in rural Michigan right now have fairs and festivals where it's standard practice to have a beer tent or a wine tent. And it's one of those things that everybody on the call right now, can advocate for more opportunities that don't normalize alcohol use or substance misuse. The next one is problem identification and referral. And Ieshia touched on this in some of the examples she provided, is getting those screenings on a regular basis. And that's a great thing that we can do, is encourage people to get screenings for opioid use disorder. That's what the OUD stands for opioid use disorder or substance use disorder, to get screenings for HIV and hepatitis C on a regular basis. And so those are ways that we can affect the potential risk for long-term disease impacting a person's life. And so there's a large percentage of the population who is using injectable drugs that is at high risk for hepatitis C and HIV and other transferable diseases because of their substance use habits. And that's why safe syringe sites is such a big deal right now in harm reduction. And you're going to continue to see that grow across Michigan and across the United States. Because we want to keep people alive so that recovery is possible, because we have faith in people. We know that recovery is possible, and we want those individuals to survive long enough to get treatment for these other things, or hopefully prevent them from getting those co-occurring diseases. So there's a lot of support we can do just with mobile clinics as another option. Mobile clinics are, again, we're seeing a rise in that so that we can treat people's other conditions, whether it's an infection or, an earache or whatever it is. We want to provide for people's needs and meet them where they're at. Through that problem identification and referral process, we are consistently offering screenings to refer people to an appropriate level of treatment. And those referrals are not just, we're always going to refer everybody to an inpatient treatment center. We're going to meet them where they're at and make appropriate referrals. So if you're ready for this, or when you're ready for this, or maybe you don't have childcare, maybe you'll lose your job if you go to an out of county clinic, maybe you need teletherapy. So we really want to, through the screening process, not just assess the level of need, but assess their level of readiness to talk about their substance use disorder or their substance misuse, because it's not always at the level of a disorder. Our community-based process is the one that I'm really focused in on right now with our coalitions, with our community-based groups that are not coalitions. These are opportunities at the community level for us to come together and address stigma and to address harm reduction efforts and come together and say, this is a priority in our area because we care about the people who are affected and we are affected at different levels. And so the community-based process, obviously we can get involved with coalitions. I would encourage everybody to get involved with their local substance misuse prevention coalition. There's great things happening across the state right now, but there's also recovery groups. And so we want to normalize the availability of recovery groups, whether that's Nar-Anon, Al-Anon, Smart Recovery, Peer 360, any of those recovery groups where we can come together, share our experience, and support one another. And we have different family-based groups as well that support the families of individuals who are experiencing a substance misuse problem. And so it's not just those traditional 12-step groups. There are recovery groups and support groups for family members as well. And then volunteer activities. One of the best things we can do is to find ways to put our needs second, to put other people's needs ahead of our own. And that perspective really helps with the recovery process. It really helps us understand that we're part of and can contribute to the bigger whole and the needs of our community at large. And that builds our awareness, it builds our connectedness, and it helps us understand that what we're doing is bigger than ourselves. And so connecting our actions with other people's well-being is a great part of the healing process, not just for individuals, but for everyone in the community. And so promote volunteer activities and get involved in giving back, because we need more of that. We were not designed to be independent, we're designed to be interdependent. As our communities, as our family groups, those are parts of how we operate best because of our human nature. And then the final CSAP strategy here is our environmental strategies. Environmental strategies impact the entire community because everybody who's living in the environment can experience these things. So the increase of safe recovery housing that's certified and managed well and is supportive, and not just a halfway house or something that people don't receive the actual support and it might not feel safe. And so true recovery housing is an environmental strategy, and making sure that that's available in every community in Michigan. Sharps disposal, drug disposals, lock boxes, those are opportunities for us as prevention specialists, as people working in our communities, as family members, to make those widespread available to everybody, to say, hey, we want a Sharps disposal, we want a drug disposal box in our community, we want lock boxes in our homes, we want them distributed to everybody who wants one, everybody who has a prescription, and make that a regular part of our environment. The last one on this list here is our prescription drug monitoring program. So the PDMP is our prescription drug monitoring program, will reduce the amount of substances, of prescriptions in our communities, was why it was introduced in Michigan. And so I don't know if anybody else on the call has a lot of experience using that. The way it was designed was to allow law enforcement, pharmacists, people who prescribe medications, to look up an individual's past prescriptions and make sure that we're not over providing to somebody. It's not about eliminating people's availability of opioids or other prescription drugs, but it is about monitoring to make sure that we can look for patterns of misuse, so we can prevent doctor shopping, so that we can prevent that over providing if that's something we can do. So yes, that is the same as MAPS. So the MAPS is our Michigan prescription drug monitoring program. Any other questions on that? Comments on that? Did I miss anything in the chat, Ieshia?
Nope, that's everything.
All right, well, I'm gonna stop sharing then and hand it over to you.
All right, so I wanted to share the last slides with you, sorry. And I wanted to take us back about the role of prevention in post of overdose strategies, and just give you an idea of what it looks like when you are in the community doing this work. We would like to provide individuals with educational resources, as Ruth went over, the CSAP strategies and how we can help along the way, and how we can provide those resources to the people by either, giving them brochures or helping them with, places to get treatment, and just finding those resources to, help our community along the way. Also promoting community readiness, also taking action, addressing the opioid overdose in the community, making sure people are aware of what's going on. Also, you can take harm reduction classes to learn a little more about harm reduction, and just being able to pass the information around can go a long way. Reducing the stigma, as I spoke earlier, provide social ecological lenses. It appears to play a role in our community. And so since it play a role in addiction, we want to, stop the way that we interplay these the way that we interplay our relationships between, ourselves, the community, and those relationships we build in any social factors around us. So, for example, we always say, like, maybe wealthier people, their children will, use drugs or, drink alcohol or have an addiction or something. So we want to just not place that, those stigmas on other people. Ensure to use evidence-based strategies. Make sure that we are approaching things and then, making sure things are important to other people, making sure we use prevention, care, and treatment programs to help along the way, making sure that we are really using those evidence-based strategies to help along the way. And so also I just gave like community services, things that you could share out in newsletters or, have on websites, just to, prevent awareness, like Hepatitis Awareness Month, Needle Disposal Week, and also National Hepatitis Testing Days or World Hepatitis Day. The biggest one for me is August 31st, International Overdose Awareness Day, where you can just pass it along and make sure people are aware of what's going on in their communities and how they can help. Because sometimes you can even volunteer for some of these services and just be the voice or reason for other people. Is there any questions or anybody want to add to the calendar or anything that they know any more days that I didn't mention here?
I think there's a lot of local events and awareness observations and awareness days and things that people can get involved in.
And so for the last slide, we'll be wrapping up. The stigma reduction is harm reduction. You can explore more principles central to harm reduction practices at harmreduction.com, or they got a lot of things on that site that helps me along the way, that can help pass along resources for other people that may need it more so. And then we are ending the recording here.